Radio Bovine. Today in the studio is Professor Theo Lam from GD Animal Health and Utrecht University. Welcome.
Thank you.
You gave a keynote today about resetting the mindset regarding antibiotic use. What was kind of the main drive for you to present about that?
Well, the main drive was, or the main message that I wanted to bring is that it's important to take antimicrobial resistance seriously, but not only from a technical point of view, but also on how to change behavior. So from a communicative point of view. We have a lot of knowledge on a lot of things, also on antimicrobial resistance, but it comes to value if we are able to transfer that knowledge into actually change of behavior of people.
And where did you think was the biggest challenge, that there was a gap between the science that we knew and the behavioral change?
The biggest challenge was specifically for this meeting, which is on cattle, is that the dairy farmers, cattle farmers are not the people with the biggest problems on antibiotic use and antimicrobial resistance, but they still need to change their behavior because society at large wants us to be responsible on antibiotic use. And well, we're not the biggest users. We don't have very big antimicrobial resistance problems, but we still had to change our behavior. And that was a big challenge.
Yeah, you've been successful in the Netherlands to reduce the amount. So what did you do to help change their behavior?
Well, indeed, we were successful in the Netherlands, and we've analyzed what we did over the years. And basically there was a parallel with what we did in the Dutch Other Health Center in the past, is that we use different communication strategies. That the basic point is that different people are influenced by different approaches, and that you try to reach a lot of different people. And that's what we call the reset model, which has different points, where you try to motivate people according to different buttons that you can push on in what we call the cockpit of behavior, which is the mindset. And that's what we call the reset model.
And what can you say about those different buckets, that how to approach people? Because not everybody, it's not a one-size-fits-all approach, I guess.
Definitely not, no. As veterinarians, we tend to mainly use the button that we called E, the E of education and information. I've been a practitioner for 15 years myself, and I was one of those people that was really convinced about the content of the work, and with the idea that once you inform people, once they know, they will change their behavior. And that's true, but only for a part of the farmers, the ones that really are internally motivated to change. And for other people, you need external motivations. We call that a peripheral communicative approach. You use other ways to change their behavior. And in the reset model, we have, as I said, 5 buttons. The first one is of rules and regulations. The R, the E is of education and information for the internally motivated people. The S is of social pressure. Everybody does it. That's why we do it. Then the E is of economic incentives. I can earn money with it. Important for people too. And the T finally is of tools, where you make it easy for people to change their behavior. And within our antibiotic approach, we used all of them. There were regulations, there were rules, because the government wanted us to decrease antibiotic use. And that's an important cue for action, of course. But still, if that would have been the only thing, then people would do it, maybe do it, but then fall back after a while. And what we did, and that's why I think we were so successful, is that we also used the other buttons. We also informed people. We also introduced, not us, but the Veterinary Drug Authority in our country, introduced an antibiotic number, the ADDD, the annual daily defined dosage. And farmers nowadays, they know what their antibiotic number is. It's as important as their cell count and their production. They know I have 2.5 or 3.5, and they know whether that's low or whether that's high. So it became part of the social pressure, or the way that they live, the way that they farm, to think about antibiotics too.
Yeah, well, the veterinarian plays an important role in that.
Sure.
But who are the other stakeholders that need to help as well?
Well, that's a very important thing, is that people from different angles sent the same message. That they all said this is important and we have to change that. And the farmers associations and the dairy corporation in the country, the food processors, they all had the same message. And people are sensitive to different motivators, but that's not black and white. You have a bit from this and a bit from that, and if the same message comes from every corner, then it works, and that's what happened.
So are there specific skills required, or is everybody able to do that communication approach that you suggest with the reset model?
Both are yes. Yes, there are specific skills required, and yes, everybody is able to do it, but not everybody is equipped as well to do it as another. Some people do things good, and some people are better at other things, but it's possible for everybody to learn this. What I just told you about is that antibiotic use as a country, that's not a thing for a local practitioner to organize. I mean, that's for stakeholder organizations, etc. But this knowledge is also applicable in your local practice. And if you only send messages through education and information, you will not reach all your clients. There are other ways to reach more clients than you do. And you can learn that. Taking communication serious is an important thing for stakeholders, for people at a national level, but also for local practitioners.
Okay, so that's my final question. So the veterinarians are watching this interview. What can they change tomorrow in their practice to improve their communication? Taking
communication seriously. We have a book that's called Communication in Practice. There's a lot of knowledge in that you can use. It's really, we call it a pracademic book. It's really with an academic background to practice. And that's available, and we are also available. I'm also available to give advice if necessary.
Okay, thank you very much for your insights. Thank you for watching Studio Bovine, and hope to see you again.